Hello. Good morning. Hello. Am I audible? Hello. आवाज
Yes, ma'am.
हाँ. काल काय काय झालं आपलं?
Aphorism 136 to 140.
What is given in that?
मॅम 136 मध्ये असं आपण मेडिसिन देत मेडिसिन इज प्रूव्ड ऑन दी हेल्दी सब्जेक्ट अँड लार्ज नंबर ऑफ पीपल ऑल दी सिम्टम्स अपियर्स in different way in different individuals
बरोबर. And hence
and
we are proving it on the different constitutions, right?
different constitutions, corporeal, mental constitutions.
Yes. Then
In 137 we have seen the qualities of prover, demerits of large doses.
Wait. Niranjan, what is given in 137? Shivani? Snehan? Patil? Anyone? Pratiksha? Priyanka? Both Priyanka?
Ma'am, 137.
Oh. 130, oh.
Ma'am, administration of large doses of medicine. It should be avoided.
Okay. Why?
To avoid the secondary reaction.
That means here you mean to say the large dose, right?
Yes, ma'am.
Okay. And what happened in the small dose? What is given in 139? One 140, 141. How the prover should be?
मॅम मी सांगू
सांग.
मॅम इथे पण आपण क्वालिटी ऑफ प्रूव्हर्स बघितले प्रूव्हर बघितला आणि दे शुड बी अनप्रेज्युडाइज्ड सेन्सिटिव्ह लिटरेट अँड केअरफुल ऑब्झर्वर्स and the duty of the physician here is to take the follow up of the patient, ask every time the prover about each and every circumstances, and get the details elicited by the prover,
Right.
and also the alterations.
Yes. And what happened in the illiterate prover?
Ma'am, when illiterate prover cannot write properly all the symptoms, so physician can ask the leading questions. They are admitted here.
Right.
So in this way we can take down the symptoms from the illiterate prover.
Yes. So up to 140 we have completed, no?
Yes, ma'am.
Now 141. Deepak, read.
वन 41.
कुठे होता तू मध्ये इतके दिवस? दिवाळी? ठीक आहे, रीड.
But the best proving of the pure effect of simple medicine in alternating the human health and of artificial disease and symptoms they are capable of developing in the healthy individual are those which the healthy, unprejudiced and sensitive physician institute on himself with all the cautions and care her enjoyed. He knows with the greatest certainty the things he has experienced and his own person.
Okay, thank you. So in the 140, we have seen the one quality of the prover. He should be a literate one. So what is the advantage? Also we have seen if the prover is literate, then he can explain his sensation, characteristics very nicely. He can join one symptom to the another. He can write down all the symptoms properly. That is, he can able to write down the complete symptom that we call location, sensation, pain, character of pain, modalities and concomitant. ये जो सब factors है which constitute the complete symptom, he can write down it properly. That we have seen for the literate prover. He can write down all the sufferings and he can report the physician after his feeling. The physician can also ask him the repeated questions so that it will be fresh in his memory. So it is okay for the literate prover. But what happened in the illiterate prover, that also we have seen in the aphorism number 140. If the prover cannot write, the physician should inquire every day about his symptoms, nature of symptoms, how they appear, the manner of the symptoms they arrive. Here the role of the physician is very much important. We have to ask the prover each and everything The physician must note down all the sensations voluntarily. And here, Dr. Hanuman has admitted that you can ask the leading questions, because otherwise the prover will not be able to give you all the details. So we have seen these two type of provers, where sometimes the role of physician is important, sometimes the role of prover is important. But now here in the 141 they have given the thing he वहाँ पे if he is the prover, then he is the best prover, then the best prover is the physician. So but the best proving जो होगी for the to know the pure effect of the simple medicine which alters the human health and which produces the artificial disease. So ये सब कुछ जिसको पता रहेगा, he is the physician. He who know the importance of the drug proving, who know the importance of the artificial disease, how it is produces, पहला symptom कब आया है, what is the sensation, he know the importance. He is that very much very trustworthy prover. The symptoms they are capable of developing in the healthy individual कि मुझे physiological condition कैसी है and now I am not feeling better. So ये जो सब sensations है, the physician knows it better and he is also the unprejudiced. He is a sensitive and that prover is a physician, and hence we call the physician is the best prover. With at the same time he will take all the caution, he will take all the care related to the diet, related to the mental and the physical work. He knows with the greatest certainty the things as he has experienced in his own person. So he know all the vocabulary, all the words which are in the medical field. He know its importance. He will take all the cautions and the care for that drug proving. He can experience all the things very nicely, and hence he is the best prover. So recording will be more accurate in the physician if he is a prover as compared to the literate and the illiterate prover. Clear?
Yes, ma'am.
Now 142. Shraddha, read.
Ma'am, footnote आहे ना?
Huh?
Footnote.
Footnote आहे? Oh. Okay, read this footnote. काय झालं, नेटवर्क प्रॉब्लेम आहे का? Alisha?
Ma'am.
Read this footnote.
Ma'am, मी वाचू?
वाच.
Those trials made by the physician on himself have for him other and inestimable advantages. In the first place, the great truth that the medicinal virtue of all drugs, whereon depends their curative power, lies in the changes of health he has himself undergone from the medicines he has proved, and the morbid state he has himself experienced from them, becomes for him an incontrovertible fact. Again, by such noteworthy observation on himself, he will be brought to understand his own sensations, his mode of thinking, and his disposition, the foundation of all true wisdom. And he will be also trained to be what every physician ought to be, a good observer. All our observations on others are not nearly so interesting as those made on ourselves. The observer of others must always dread lest the experimenter did not feel exactly what he said, or lest he did not describe his sensations with the most appropriate expressions. He must always remain in doubt whether he has not been deceived, at least to some extent. These obstacles to the knowledge of the truth, which can never be thoroughly surmounted in our investigation of the artificial morbid symptoms that occur in others from the ingestion of medicine, cease entirely when we make the trials on ourselves. He who makes these trials on himself knows for certain what he has failed, and each trial is a new inducement for him to investigate the powers of other medicines. He thus becomes more and more practiced in art of observing, of such importance to the physician, by continuing to observe himself, the one on whom he can most rely and who will never deceive him, and
थकली का
he
अंजली?
uh,
थकली असेल तर सांग, आपण थांबू तिथे, मग नंतर पुढचं वाच.
थांबा वाचते एवढं. By continuing to observe himself, the one on whom he can most rely and who will never deceive him, and this he will do all the more zealously as these experiments on himself promise to give him a reliable knowledge of the true value and significance of the instruments of cure that are still to great degree of unknown to art.
बस.
मॅम नंतर वाचते.
कुठे गेलं? व्हॅल्यू अँड सिग्निफिकन्स ऑफ इन्स्ट्रुमेंट. हा, आर्ट पर्यंत वाचलं ना?
हो मॅम.
ठीक आहे, आपण पहिले एवढं घेऊ, नंतर बघू. So here they have given a long footnote key why the physician is a best prover. Those trial made by a physician on himself, the drug proving when it is carried out on the physician, have for him an unestimable advantages. Unestimable means it has a, what is inestimable? Very, very important. It has a large importance, or it has a large advantage. In the first place, the great truth. So what are the advantages? The first one is a great truth that the medicinal virtue of drugs. We are finding out something which is hidden in that medicine, in that drug. We have to find out कि what is there. हमको कुछ तो भी खोज के निकालना है, which is present very deeper. So वो जो truth है, वो जो सच्चाई है, वो हमको find out करनी है, and that thing will find out by the physician very nicely, whereon depend upon the curative power lies in the changes of the health he has himself undergone from the medicine he has proved. और उसका what we are using for that, वो जो hidden power है, we are using it for the betterment of the patient. So though that physician is having the pain, though that patient prover is having the certain type of sensation, but the utility is very nice. उसका future जो है, it is very, very nice for the patient, because with the help of that knowledge we will cure the patient. So whole humanity will get the advantage of it, and that's why the physician is proving that medicine on himself, so that he will get the genuineness of the medicine. So yet truth, physician knows very well, and hence it is he will do it with all the pain and all the things. वो पूरे मन से ये सब कुछ करेगा. And the morbid state he has himself experienced from them becomes for him an incontrovertible fact. तो उसको कोई deny नहीं कर सकता है कि the morbid state which he is experiencing with all the great pain and all the things, but he know okay, this is only for the betterment of the patient, for the future it is very much important, and that's why he is deliberately developing the morbid state in his body. He is experiencing all the things, and this is the uncontrovertible fact. Is no one can deny कि he is having the pain, but still he is doing it only for the betterment of the humanity. Again, by such noteworthy observations on himself, he will be brought to understand his own sensation. The second advantage is that he can write down all his sensations by his own word. As I have told previously, he know all the medical terminology and all the things, so that he can write down all the sensations very nicely. His mode of thinking and his disposition also, he can write down it properly, how he is thinking, what he is thinking previously, and now what are the changes in his thinking, how the dispositions are changes from before to now. He can write it down very properly, and he will be trained to be what every physician ought to be, a good observer. And the third advantage is that when he will do it on another person, so now he is trained usko, he will, because he has experienced all the things, उसको पता है कि what the changes are occurring during the drug proving, because वो खुद feel कर रहा है उसको. So he will be more alert and he will be more attentive when he will be a observer. Are you getting the things?
Yes, ma'am.
Because when you experience, जब आपको जैसे आपने you have given the first year examination regarding the anatomy, physiology and pharmacy. So if one junior comes to you and he asks ki, how to write down the paper of physiology, what points I have to include in the anatomy, how to draw the diagram in that anatomy, so you will be able to give all the knowledge to that junior कि ये ऐसा निकालना है, ये वैसा निकालना है, ये छोड़ दे, ये कोई नहीं पूछता है, ये सिर्फ 5 मार्क के लिए आता है, ये मैम ना बहुत बोर करते हैं ये टॉपिक ये करने के लिए, लेकिन इसमें कोई पूछता ही नहीं है, ये छोड़ दो. ड्रग प्रूविंग अच्छे से करो, पोसोलॉजी अच्छे से करो, बिकॉज इट ऑल विल कम विद फॉर द 20 मार्क. बाकी का ये लेजिस्लेशन वगैरह छोड़ दो, ये कोई नहीं पूछने वाला. सो यू विल गिव योर एडवाइस टू दैट जूनियर वेरी नाइसली. करेक्ट?
Yes, ma'am.
Yes or no? Say all the participants yes or no.
Yes, ma'am.
आपको पूछते होंगे ना
Yes,
आपके
ma'am.
roommates जो junior है.
Yes, ma'am.
So because you are experienced, for as you have given the first year examination and you have cleared it successfully. Similarly, the physician who experience all the sensation and functions beforehand, he can take all the signs and symptoms from the prover very nicely because he is trained and he is experienced. All our observations on others are not nearly so interesting as those made on ourselves. So when you are proving on yourself, it will become more interesting as compared when you are as a observer. The observer of other must always dread lest the experimenter did not feel exactly what he said, and the least he did not describe the sensation with the most appropriate expressions. So जैसे illiterate prover मैंने आपको बताया था कि वहाँ पे हमको बहुत ज़्यादा voluntarily we have to ask the questions. छोटे छोटे questions we have to ask. But here there is no need to ask all these things very much deeply. As he know all the sensation, as he know what he feel exactly, he know all the terminology, so he can express all the expressions very appropriately. He must always remain in doubt whether he has not been deceived at least to some extent. तो उसको भी ये डर लगा रहता है कि because of my anything, if I am telling the wrong, so same thing will happen with the patient, and hence he will not deceive the observer. These obstacles to be knowledge of the truth, which can never be thoroughly surmounted in our investigations of artificial morbid symptoms that occur in other from the ingestion of the medicines. So surmounted means overcome. So all the obstacles that we have seen for the literate prover or for the illiterate prover, so all these obstacles will be overcome by the investigation if the physician is himself as a prover. He will able to give all the symptoms after ingestion of the medicine entirely, and this make our trial very nice, and this will give you the whole picture of the disease. He who makes this trial on himself knows the certain what he has felt, and each trial in a new inducement for him to investigate the power of other medicine. Every time he will feel the different sensation. He will take it as a challenge and he will do it very nicely. He will help you to investigate the hidden power of the medicine. तो यहाँ पे कहीं पे भी कुछ डिसीवनेस नहीं होगा, कुछ वहाँ पे एक्सेसिव नहीं होगा, या फिर कोई छुपाने की बात वहाँ पे नहीं होगी. All the things will be crystal clear for that observer, because physician knows all the things. He know the importance of trial. He know the sensations very nicely. He can felt the abnormal things very nicely as compared to the other. And the important thing is that he will use that same medicine to the patient, and hence he can ask the case taking. अगर वही मेडिसिन सपोज वो एडियम सटाइवा प्रूव कर रहा है या बेलाडोना प्रूव कर रहा है, एंड इफ द सेम पेशेंट कम बेलाडोना का पेशेंट है, सो ही कैन टेक द केस टेकिंग वेरी प्रॉपरली, और उसको भी पता रहेगा कि ये मैंने फील किया है बेलाडोना के पेन, मैंने ये हेडेक ऑफ बेलाडोना मैंने फील किया है. सो जब पेशेंट बोलेगा कि आई वांट टू बोर माय हेड इनटू द कुशन, सो ही कैन फेल इट वेरी नाइसली, और वो मेडिसिन भी बहुत इजीली अच्छे से सिलेक्ट कर सकेगा कि क्योंकि उसने ये फील किया है पहले ड्यूरिंग द ड्रग प्रूविंग. ही दस बिकेम मोर एंड मोर प्रैक्टिस इन द आर्ट ऑफ ऑब्जर्विंग. वो अच्छे से ऑब्जर्व भी कर सकेगा बिकॉज ही नो द इम्पोर्टेंस. ही कैन कंटिन्यू ऑब्जर्व हिमसेल्फ. वो खुद को भी उसने अच्छे से वो ऑब्जर्व कर सकेगा कि पहले मुझे हेडेक नहीं था, नाउ आई एम हैविंग द हेडेक ऑफ विच टाइप, वेयर इज द लोकेशन. सो लोकेशन में आपको प्रिसाइज वहां पे मिलेगी कि वेदर इट इज अ फ्रंटल, ऑक्सीपिटल, पैराइटल, ये सब कुछ चीजें आपको अच्छे से मिलेगी. आफ्टर दैट द सेंसेशन यू विल गेट इट प्रॉपरली बिकॉज ही इज ऑब्जर्विंग कंटिन्यूअसली. द वन ऑन हिम ही कैन मोस्ट रिलाई and will never deceive him, and this he will do all more jealously as jealously experiment on himself, promise to give him a reliable knowledge of true value and the significance of the instrument of care that are still a great degree of unknown our art. So एक तो वो रिलायबल रहेगा, he will more enthusiastic, he is a promising character, he will give you the true knowledge, the true significance of the instrument that we will use to cure our patient. So these are all the advantages if the physician is the prover. Let it not be imagined that such a slight indispositions caused by taking the medicine for the purpose of proving them can be in the main injurious to the health. अगर इसके बीच में कुछ इंडिस्पोजिशन हो जाता है, उसने अगर कुछ खा लिया या कुछ स्मेल से या कुछ भी अगर इंडिस्पोजिशन आता है, सो दिस मे डिस्टर्ब द प्रूविंग. Experience shows on the contrary that the organism of the prover becomes by these frequent attacks on his health all more expert in repelling all external influences inimical to his frame and all artificial natural morbifications, and became more hardened to resist everything of an injurious character by means of these moderate experiment on his own person with medicine. His health became more unalterable. He becomes more robust as the experience shows. तो कभी कभी slight indisposition का problem आता है proving में, but if he is a physician, he will avoid it next time. So here he used the word slight indisposition. So that will not affect much in the proving. लेकिन यही अगर प्रूवर illiterate है या literate है, so they will not be able to judge whether this is the indisposition or this is a real symptom. Next what he says कि experience shows that कि whenever you are doing the proving, so what are the advantages of that proving? So the first thing is that you will become a more robust, your health, your immunity will increase. Third thing is that you will become a more unalterable, you will become a more pure, you will become a good observer. Then the artificial natural morbific noxious agent जो भी act करेंगे आपके body में, so as your immunity will increase, so they will not have any chance to act on your body. So in this way you are become a more robust. So this shows by the experience we can do the proving on our body, and because of that you will get such advantages. So if the physician is the prover, all the advantages are given in this footnote. The physician knows the greatest importance of this drug proving, and hence he can prove it very nicely, very certainly, with all the patients, with all the truth. And because he know he this can useful for the treatment of the patient. All the medicinal qualities of the drug which changes the health, he when he undergone under will he experience, he can ask the patient it very nicely. As he is doing the self observation, he now became a trained physician afterward. These all the experiments are very much promisable. This will give the reliable knowledge so that we can use that medicine for the cure of the patient. And the next and the most important advantage he has given that if that drug proving is well conducted, it will never produce any injurious effect on the health of that person, but on the contrary he will become a more robust, his health became more unalterable, he will have all the immune power. So all are these advantages if the physician is if the prover is a physician. Understood? Say yes or no. What
Yes,
happened?
ma'am.
Yes, ma'am.
Any query, any problem in this? Anyone wants to ask something for this long footnote?
No, ma'am.
So what are the advantages? Can anybody give me 2 to 3 advantages? Anyone?
Ma'am,
Huh.
we find out what is there in the drugs. Then no need to ask things very deeply,
Right.
and we can expresses the all things appropriately,
Yes.
and all obstacles are overcome by the investigations.
Yes.
He will
Anyone else?
help.
Hmm.
He will help you for the investigate the disease. All things are clear for the physicians.
Yes. And what are the advantages for that physician, for that prover as a physician?
He can give accurate medicine
Yes.
as he always experienced first.
Yes. Then he can take the case of that person properly. He will take all the minute things. He will ask because he experienced it very nicely. Then next. we can overcome the problem like indisposition, slight indisposition, which will be very difficult in the literate or the illiterate prover or any other prover, right? Then अजून काय ऍड कराल याच्यात? This will become a very promising trial because we will get all the truth from the physician. And the important one is, what is the last advantage he has given in the last line?
Immunity increases.
Yes. So health will become more unalterable. Morbific noxious agent will think 100 times to act on your body. So the power to fight against the disease will increase, to fight against the infection will increase, and this will become a robust constitutions. Okay. Understood everyone?
Yes, ma'am.
Any problem, any doubt in this?
No, ma'am.
No, ma'am.
Okay.
Yes, ma'am.